Hello, everyone. It's Dr. O'Brien coming to you from a lovely day sitting outside in North Texas in front of my dirty pool. I wanted to talk briefly about something while it's in the headlines, and that is the confirmation hearing for Dr. Casey Means as the nominee for Surgeon General of our country. She and I practice the same sort of medicine. We have a similar background where we started in conventional medicine and then realized that there was a better way. I do believe that functional medicine is the way that we should practice medicine, addressing root causes and reversing disease rather than treating disease. However, there are some important concerns that were raised that need to be discussed. And we need to do that from a place of not political alignment, but from careful consideration, not only for the confirmation of a surgeon general, but for how we seek medical care and treatment for ourselves, for our family, as a community. And there are concerns that I have personally that I'll also share. So, obviously, because I practice functional medicine, I fully endorse the approach to look at the root cause. And to give a brief explanation of that, what does that mean? Instead of giving a medication that would improve insulin sensitivity, for example, for someone with either prediabetes or type 2 diabetes, there's plenty that we can do to help a patient understand what's going on in their body that is presenting itself as insulin resistance, as elevated blood glucose, as elevated just morning blood glucose. And much of it is far more safe than medication, which frequently causes side effects because it doesn't just do one thing. That medication doesn't know that where you want it to go in the body and just act in one place. So, what are the limitations, right? Why would I be opposed or why would I pause and consider if this is the right move? Just as there is a lot of outcry about physicians being biased by financial incentive, which we frequently hear referred to as big pharma, there's a lot of financial self interest in the functional medicine, alternative medicine, holistic medicine sphere. Further, most of what we use is not regulated, meaning there is nobody checking to see what is in your nutritional supplement, other than perhaps a third party hired by the manufacturer. And when I ask a patient to take a supplement, especially in the state of Texas, a very Republican, longstanding, very red state, there are multiple hurdles that I have to jump as a physician to establish safety and effectiveness, as well as informed consent for my patients as to what the standard of care would be versus what I'm recommending. Now, those are kind of big terms, and it sounds like I'm being um, evasive. But what I'm really saying to you is the treatment that you choose to take is within your own personal autonomy to choose to take it. But when we want to discuss how we're going to address medicine as a nation, as to what we can give safely, many, many changes need to be put in place for your protection. Most supplement companies, many lab corporations offer incentives to those that suggest them, recommend them, or prescribe them. And that does bias your provider, not a word I like. I don't like the word provider. I prefer the word physician because I am one, but we'll say provider because everyone seems to be dispensing medical um, advice these days. People that have no medical training, some who have a cursory exposure to basic science and an online course, for example. And while I do think that they are well intended and they do want to help, if I'm getting $100 a pop for every patient that orders a lab at my recommendation, do you really think that that doesn't influence my decision? Now, let me state clearly that I accept no such kickback. If I order a laboratory test from my patient, it's because I need that data. And my income stream is my time, my expertise, my training, my advice. And my patients know, I tell them straight up that I don't get a financial incentive in deciding which labs I want to get or which imaging I want to get in order to make decisions and advice in their interest. But if we made that the standard of care in this country, imagine how difficult that would be to control when those companies do offer significant financial incentive to doctors to do that. It's illegal to do that, to accept that level of recompense in exchange for recommending a laboratory or a diagnostic test. Does that mean doctors don't do it? Probably not. And how would you know? The requirement has to be in place where doctors have to disclose. And I think all providers, whether it's a health influencer on TikTok who is getting incentivized for your click, or much more incentivized by the money that they earn if you go forward and order that particular laboratory test or wearable or supplement. And that kind of bias is extremely important to understand when the people that may be making the decisions in your quote unquote interest may have their own interest much more in mind than you would know. So, as we listen to the hearing and we listen to the questions that are being posed, I want you to try to put whatever political particular affiliation you have aside and think about, do we want to take a medical system that has been corrupted by self-interest, by insurers who clearly make more money if they say no to your CT scan or no to your laboratory evaluation that I order, and turn it into the Wild West, where your physician could be recommending a particular treatment or evaluation for which they get paid? I think that's much worse. And while I can tell you that I have never received any form of recompense from a pharmaceutical company, ever, beyond a box of Kleenex that may have said Crestor when I was in medical school or a pen that said Abilify, I've never received anything, nor should I, nor would I. I want all of us to try to take a step towards center and listen to each other and consider, could everyone afford to go on a medicinal diet? Are the foods that are recommended in the new food pyramid that's upside down, are those foods available to the majority of us in this country? And what about recommending organic foods while also incentivizing the production of glyphosate? We have to think about these things because it is not a simple cut and dry issue. And that is best exemplified in the beautiful state of Texas in which I live and practice and take care of patients. If I live in a state that is politically aligned with our national government, I live in a Republican state, I live in a Republican country, Republican-led country, yet I do not have the freedom to practice the kind of medicine that I practice without significant hurdles that cost me a lot of money to have in place and put me at extensive risk in terms of being persecuted, investigated by the medical board in this state. So, if we want to make America, the country, all of us, healthy again, the first thing we need to do is talk less and listen more and ask important questions and follow the money on all sides of the aisle politically and on all sides of those involved in medical decision making. Because unfortunately, that decision is not made by me and my patient alone. There are many factors that muddy that water. And I want all of you to consider, if you wouldn't inject something that I gave you as a doctor and just said, no, trust me, just trust me. This is great. This is great for you. I would hope that you would have significant reservation to do that and ask me a lot of questions. And in my practice, I don't wait for the questions to be asked. We talk about it and I give extensive informed consent. What are we doing? Why are we doing this? What else could we do? What might happen? What might not? How are we going to check to make sure? That is a choice that I make based on my integrity and my ethics and my commitment to my patient and my fiduciary obligation. And that fiduciary obligation is very specific to a licensed medical provider. I am obligated to make the best decision in your interest as I understand it, not mine. And if I'm making $100 every time a patient orders Function Health Labs because I have recommended it on social media, that's disgusting. It's corrupt. It's self-centered, and it is not making America healthy again. If you receive laboratory results without appropriate guidance, and I would argue with you that an AI-generated lab report is not sufficient. That is not what you deserve. It is far more that I want for all of us, both myself as a patient and a consumer of the medical system, and as a physician who provides care to many patients, and as an advocate for every American to be able to get healthcare that is safe, effective, appropriate, and as minimally invasive as possible. So that means if I want you to take a vitamin, I better follow that level and make sure that I've given you the appropriate kind and that your body's responding the way that I expect it to. Because 10 years of doing this, I've realized that I may think that a particular herb has a particular impact, but it may not in you. And by witnessing that personally in my patient population, I know firsthand that this is bigger than a protocol, than, oh, if your inflammatory markers are up, you need to do this, or that everybody should avoid a particular food or substance because it's quote unquote bad for them. You're more than that. And in order for us to genuinely overhaul our medical system, it's going to first take everyone who has financial interest in those decisions to admit that. Admit it. Admit that you enrich yourself off of the things that you recommend and allow your patients to understand if they want to participate in that with you or not. So, while I love Dr. Means, I love her book, I love her ethos, I love her approach, I practice similar medicine, I encourage her to fully disclose the way that she has benefited from the decisions she makes. And I would implore her to please discuss the fact that practicing medicine in a functional approach opens the door to a lot of risk for patients with unregulated and untested products. And we have to first put protections, advisories, something in place to allow consumers to understand what it is that they're getting and from whom and how that person may benefit from that decision. We got it wrong. We've got it wrong already in a medical system that is broken, reactionary, and a pill for an ill. But if we replace that with a system that simply changes the prescription of a medication to the recommendation of a supplement and allows far more kickback and self-enrichment than anything that I've ever seen as a physician in the traditional system, we've got it wrong. So, at this moment, with the opportunity that we have to speak and make changes and really dig down and get this right, let's all be part of the solution and a conversation and not an argument and not a political debate and not a simple rubber stamp for I vote red and so I agree or I vote blue and so I don't agree. And let's talk about, I'm willing to be part of that conversation. I'm willing to answer any questions that you have. I'm willing to show you evidence of anything that I say that seems incredible or unbelievable, because it is incredible and it is unbelievable, but it's happening. And I think that you're worth far more than that. So my ears are open. The channels of communication are always open, either through private messaging or contact my office. I'm happy to do it. I'm excited to do it. I am motivated to do it for my health, for yours, and for the wellness of our community and our country at large. We should be leaders in this movement, and I hope that we do that with integrity, with ethics, and with love for one another.